Acute limb ischemia occurs when there is a sudden lack of blood flow to a limb. Acute limb ischemia is caused by embolism or thrombosis, or rarely by dissection or trauma. Thrombosis is usually caused by peripheral vascular disease, while an embolism is usually of cardiac origin. In the United States, ALI is estimated to occur in 14 out of every 100,000 people per year. With proper surgical care, acute limb ischemia is a highly treatable condition. However, delayed treatment can result in permanent disability, amputation, and/or death. The new Latin term ischemia as written, is a British version of the word ischaemia, and stems from the Greek terms ischein to hold, and haema blood. In this sense, ischemia refers to the inhibition of blood flow through the limb. Related ischemic conditions: when a limb is ischemic in the non-acute setting, the condition is alternatively called peripheral artery disease or critical limb ischemia, rather than ALI. In addition to limb ischemia, other organs can become ischemic, causing renal ischemia, mesenteric ischemia, cerebral ischemia, cardiac ischemia. Signs and symptoms: acute limb ischemia can occur in patients through all age groups. Patients that smoke and have diabetes mellitus are at a higher risk of developing acute limb ischemia. Most cases involve people with atherosclerosis problems. Symptoms of acute limb ischemia include pain, pallor, paresthesias, poikilothermia, pulselessness, paralysis. These symptoms are called the 6 Ps. They are commonly misattributed to compartment syndrome. One more symptom would be the development of gangrene. Immediate medical attention should be sought with any of the symptoms. Epidemiology: the major cause of acute limb ischemia is arterial thrombosis, while embolic occlusion makes up 15% of causes. Arterial aneurysm of the popliteal artery has been found to create a thrombosis or embolism resulting in ischemia. Diagnosis and prognosis: in order to treat acute limb ischemia, there are a series of things that can be done to determine where the occlusion is located, the severity, and what the cause was. To find out where the occlusion is located, one of the things that can be done is simply a pulse examination to see where the heart rate can be detected and where it stops being sensed. Also, there is a lower body temperature below the occlusion as well as paleness. A Doppler evaluation is used to show the extent and severity of the ischemia by showing flow in smaller arteries. Other diagnostical tools are duplex ultrasonography, computed tomography angiography, and magnetic resonance angiography. The CTA and MRA are used most often because the duplex ultrasonography, although non-invasive, is not precise in planning revascularization. CTA uses radiation and may not pick up on vessels for revascularization that are distal to the occlusion, but it is much quicker than MRA. In treating acute limb ischemia, time is everything. In the worst cases, acute limb ischemia progresses to critical limb ischemia, and results in death or limb loss. Early detection and steps towards fixing the problem can salvage the limb. Compartment syndrome can occur because of acute limb ischemia because of the biotoxins that accumulate distal to the occlusion, resulting in edema. Treatment surgery. The primary intervention in acute limb ischemia is emergency embolectomy using a Fogarty catheter, providing the limb is still viable within the 4-6 hours time frame. Other options include a vascular bypass to route blood flow around the clot. Pharmacological thrombolysis: those unsuitable for surgery may receive thrombolytics. In the past, streptokinase was the main thrombolytic chemical. More recently, drugs such as tissue plasminogen activator, urokinase, and anastoplase have been used in its place. Mechanical methods of injecting the thrombolytic compounds have improved with the introduction of pulse spray catheters Euro, which allow for a greater opportunity for patients to avoid surgery. Pharmacological thrombolysis requires a catheter insert into the affected area. Attached to the catheter is often a wire with holes to allow for a wider dispersal area of the thrombolytic agent. These agents lyse the ischemia, causing thrombus quickly and effectively. Mechanical thrombolysis: another type of thrombolysis disrupts the clot mechanically using either saline jets or, more recently, ultrasound waves. Saline jets dislodge the clot using the Bernoulli effect. Ultrasound waves, emitted at low frequency, create a physical fragmentation of the thrombus. Considerations in treatment the best course of treatment varies from case to case. The physician must take into account the details in the case before deciding on the appropriate treatment. No treatment is effective for every patient. Treatment depends on many factors, including location of lesions, anatomy of lesions, patient risk factors, procedural risk, clinical presentation of symptoms, duration of symptoms, etc. References